Welcome to Here Where You Belong, your go-to podcast for exploring belonging, with your host and belonging expert, Dea Irby. We are thrilled to have you join us. Together, we'll dive into the depths of what it means for each of us to find our own place in the world, whether it's within our communities, our relationships, or within ourselves. Today's episode is meant to inspire, uplift, and remind you that no matter where you are or where you're headed, you have a place where you truly belong. So, grab a cozy spot and settle in. Welcome to Here Where You Belong.
Hello, awesome belongers. Welcome home to Here Where You Belong podcast. Today, I am so excited to introduce you to someone whose message is so aligned. There's no question that they found their place here to share their stories. I'm Dea, your host, and our guest has a unique near-death experience. Get ready to be inspired and blessed. Let's welcome Dr. Michael J. Hession. Hey, Doc.
Hey, Dea.
Ooh, here's a bit more. Buckle your seatbelts, because I'm not going to tell you everything, but these are the highlights. Dr. Michael J. Hession is a distinguished graduate of Boston College High School, Boston College, and Dartmouth Medical School, where he was elected to Alpha Omega Alpha. His journey to becoming a physician is marked by resilience and deep empathy, shared not only by academic accomplishments, but by the profound personal experiences. During two near-death encounters and health challenges, he emerged with a profound understanding of human frailty, enriching his medical practice with unique empathy. Michael authored his memoirs, the best-selling Physician, Heal Thyself, Nearly Dead and the Journey Back to Health. Ooh, you can get that on Amazon. Physician, Heal Thyself resonates and helps guide both survivors of near death and their loved ones through the agony of recovery and the Herculean task of rebuilding a life. Among many medical activities and recognitions, Michael serves as an attending physician at South Shore Hospital and as a consulting physician at Brigham and Women's Hospital in Boston, Mass. Additionally, his contributions to medical education are notable. He's held academic appointments as a clinical instructor in medicine at Harvard Medical School and as an assistant clinical professor of medicine at Tufts Medical School. And that's not everything. Beyond his professional endeavors, Michael finds joy in sharing life's adventures with his wife of 40 years, Colleen, as they live on Cape Cod, Mass, or spend winters in Florida. Welcome, Michael. Did I leave? I know I left out things. Is there anything you want to add, correct, or comment on?
No, that was an awesome introduction, and thank you for having me as your guest today.
Well, it is our pleasure. And as you know, this is a podcast about belonging, and you are on here to tell us about your belonging story, belonging to life, if nothing else. So I'm going to let you just take it away. The mic is yours. Let's have it.
Thank you. So I guess my first sense of belonging was in the medical community as a physician. And that was my life, working 60 plus hours a week. And until December of 2013, around the middle of the month, I came down with a cold. Nothing troublesome, except the cold just didn't get better. And after a week, I went to see my primary care doctor, and I was diagnosed at a chest x-ray and exam and some blood work, and it showed I had a simple pneumonia. Had no fever. My oxygen saturation was excellent. My white blood cell count was not elevated. So I was prescribed oral antibiotics with the expectation that it would do the job and I would get better, except they didn't. I continued to get worse. And December 31st, 2013, I woke struggling to breathe. My wife had already been woken up on my ragged breathing. She's a nurse. Both of us knew I was in trouble. Called 911, and I was brought to the hospital where I'd cared for patients for decades. In the emergency room, they repeated the x-ray, and now the pneumonia was in both lungs. the entirety of both lungs. It's a condition that's called acute respiratory distress syndrome. It's a very poor prognosis and requires life support. I was transferred to the intensive care unit, and they asked me if I wanted to be on life support. I remember saying, I want to live. And then they gave me medicine to potentially knock me out because being placed on a ventilator is a very unpleasant sensation. When I woke, I couldn't remember what happened or where I was. The medicines they give you are a combination of two, benzodiazepine, which helps induce amnesia and calms you, and then another short-acting opioid for take away the discomfort. Then they give you a muscle relaxer to make the intubation process easier. And when I woke, I didn't remember where I was, what had happened to me. I just knew that I couldn't move. So I'd been chemically paralyzed. I couldn't really see.
How long were you, how long was it before they gave you your cocktail and you woke up? When you said, when I woke up, how long was that?
I don't know. I mean, time ceased to be a dimension. The medicines they gave me were to prevent anxiety and pain. So they kind of dulled your senses. I couldn't really see without my glasses. So everything was just a blur. But there was no differentiating night from day or anything. So I don't really know. I don't really know the answer to that question. I remember the next thing was something that I could never forget. It was very uncomfortable, painful, and my first episode of being suctioned. And it's a hard experience to describe, but if you saw the movie The Mummy, when Imhotep inhales the life out of the grave robbers, it's like that. You feel something going into the back of your throat, and they suction out all the debris from the pneumonia and all the oxygen, and it's extraordinarily unpleasant. I could feel my muscles tighten up and my heart race, and it was something that was essential to helping me recover from the pneumonia. But it was something you really could not get used to. And that would happen multiple times a day.
Ugh.
And that went on for, again, I'm not really sure because I can't time, as I said, time ceased to be a dimension. But it was after one of those suctioning episodes that I didn't remember waking up. It was a different feeling than the prior ones. I could feel like my body was being pulled away, and my body started to feel cold. It made no sense to me. I could hear wailing in the background. The Gaelic word is keening, and it's the sound that family members make. It's a mournful sound when someone dies, and I couldn't really understand why I was hearing that sound, though I continued to feel my body being pulled away and getting colder. And I saw in the distance, when I looked back, I could see my family, and they were all crying and trying to pull me back, but a more powerful force was pulling me away. Then I stopped hearing or seeing them. I'm not sure how long the next period lasted, but at some point I began to see a light, and it really didn't have a form at first, but it was warm and comforting. As I was brought closer to that light, it took on the appearance of a woman in luminous gown, and she said something that I could never forget. I said, "Michael, it is not your time. You must go back." At that point, I realized I had died. That keening, that wailing, meant my family was mourning my death. And then the next memory I have is that of my wife talking into my ear, telling me where I was, what had happened, and that I had started to show that I was responding to the treatment. It must have been several days, but I don't really know. but it's a sensation that has stayed with me and has brought me, I think, in many ways closer to other people who've experienced near-death experiences. There's a commonality that people see alike, and there's really no good scientific explanation for it. People have come up with hypotheses, but I think it's really an experience that you have to almost accept by faith that, this was something that happened to me that nearly caused me to die, but I got a second chance at life. And then as I started to get better, the dosages of the medicines they gave me to sedate me began to be tapered down to allow me to wean off the ventilator. Unfortunately, these medications have as a side effect of suppressing your breathing. So in order to successfully wean off the ventilator, they had to take away bit by bit, incrementally, the sedatives and the painkillers. And the pain of the tube down my throat really became at times unbearable. And all the strategies that I had kept to keeping my mind busy to keep me from losing my mind, began to be drowned out by the constant pain. And they talked about whether or not I should have a tracheostomy. And the physicians were encouraged that I was making progress and asked me to find the strength to keep going. So I did. And after 11 days, I was successfully extubated. And I was put on a BiPAP mask, which goes from your forehead down under your chin, tightened back to force oxygen into my lungs, but without a tube. That lasted for several days. Then I was transitioned to oxygen by a nasal cannula. And at that point, it became apparent that I couldn't move. Couldn't move my arms, couldn't move my feet. I was paralyzed. At first, they thought it might be a side effect of the paralytic agent they gave me to prevent me from fighting the ventilator. But after several days, it didn't clear. So that was excluded. And they ultimately diagnosed me as having Guillain-Barré syndrome, which is rare, but not unheard of, complication of viral infections, particularly pneumonia. And that launched me on the second part of my journey. I had survived near death, but now I had to get past this paralysis. And
You had to live.
and honestly, nothing in my training had prepared me for being a patient. I can tell you definitively, being a patient is much more difficult than being a doctor. And I had just really begun to wrap my mind around the fact that this simple pneumonia had developed into acute respiratory distress syndrome with my situation probably be close to 25% chance of living, but I made it. Now I had to face the facts of overcoming this paralysis. And I was a cardiologist, so I really never took care of anybody with Guillain-Barré syndrome, so I didn't really have any real life experience on what to expect. I essentially knew the trajectory. It's about 6 months to a year. And usually after that time, you can ambulate with a walker or with crutches and to be discharged home. My wife and I, talked about it. The case managers wanted to have me go to a chronic care hospital, thinking it was going to be a very long recovery, but I was determined to fight and to get better. And so we demanded that I be transferred to an acute rehabilitation hospital, Spalding Hospital in Boston. And that was a very pivotal decision. It was crucial to my recovery. I think the trajectory of my recovery would have been very different and probably completely different than what it was. I was transferred there in February, and it was very cold. I remember the shock of the freezing air as they were lifting the stretcher into the ambulance. And when I got to Spalding Hospital, I was transported up to the floor where I was going to spend the next month and a half. And when I came out of the elevator, I saw the words spinal injury floor. And I think it was at that moment that I realized that this was going to be a far more difficult problem to overcome than my near death with acute respiratory distress syndrome. I couldn't move my fingers. I couldn't wiggle my toes. I couldn't even swallow. I had to be taught to swallow, to use my fingers, my hands, my feet. And so every day it was 3 hours of physical therapy, an hour with speech and language to learn how to swallow again, then an hour of physical therapy. And it was painful. I mean, my muscles hadn't been used in weeks, and my tendons had contracted, and it was just painful to even have my arms and legs moved. But I had to endure the pain in order to get better. And little by little, I progressed. My first victory was learning how to swallow again and eat solid food.
How long
Can't tell
did
you,
that take? How long did that take?
over a week.
Wow. Yeah.
But that was my first victory, being able to eat. And then little by little, the muscle spasms and the stretching of my tendons helped improve my flexibility. And slowly but surely, they would get introduced strengthening exercises, and like 640 muscles in the body. And I think just about every single one of mine had atrophied and had to be rebuilt. So
Wow.
it was a Herculean effort, but they did it, and it was hard work, exhausting, and just to even do the simplest activities. But each week I would get stronger. I'd make progress, and then after several weeks, I was able to. They would get me up into a wheelchair, and they got me an electric wheelchair,
Yay.
which I can't tell you how liberating that was. I'd never really thought much about it, but when you're paralyzed, being given that mobility is liberating and powerful. And it was a little awkward. They had me using the control with my left hand, and I didn't quite have the dexterity I should have. I, after a couple times of crashing into the wall, they asked me to slow the speed down.
You probably have some stories about or a few wrecks up and down the hall.
Yes, yeah. They did two speeds called turtle and rabbit. They
Okay.
said, just do turtle speed. So little by little, my coordination and my strength improved. And they took me to the small gym on the spinal cord floor, and had me do some arm exercises, and it was utterly exhausting. But I had to do it. I did it, and little by little, the strength in my arms and my legs came back. And after about 3.5 weeks, I graduated to crutches.
Wow.
And then they the Lofstrand crutches, the ones that Forrest Gump used in his movie, they're specifically designed for people with neuromuscular injuries. And they took me down to the big gym at Spalding Hospital, which was a amazing place. It was 2 stories, floor to ceiling glass, looking out over Boston Harbor, and there were like dozens of people there in the same situation that I was. Most of them were paralyzed, and they were intensely focused on what they had to do, which is learning to use their hands and their legs again, if they could, or to strengthen what muscles they could use. And it was intense. The first time they had me up on the parallel bars, if they hadn't had me in a harness, I probably would have fallen to the floor. But they kept at it and kept finding ways to motivate you. I think one of the most amazing things about these acute rehabilitation hospitals for patients with spinal cord injuries, or in my case, Guillain-Barré, is the amazing attitude that everyone has to find a way forward, to find your strength. That was their motto: find your strength.
Mm-hmm.
And I didn't really have much strength, but I did have inner strength. I had a very deep capacity for hard work that I had honed
We're
in
going through
school.
medical school.
Yeah.
I
So
mean, yeah, long hours, everything. Yeah.
hard work didn't scare me. So I was
Mhm.
okay with that. And I was able to break up my activities into the three parts. And then in the evening, I was supposed to do my homework exercises. And they gave me a notebook with blank paper in it. They wanted me to keep a journal. It wasn't until around the fourth week that I was able to get enough dexterity in my hands that I could write anything down. So I began to write thoughts, impressions, and I referred back to that when I started to write the book, and I elaborated on those. But after about 6 weeks, actually, go back and say, at 5 weeks, they let me have a day pass, and my wife and I went to our favorite restaurant on the water in Boston Harbor, and she pushed me in the wheelchair, and it was amazing. It was just to be outside, to feel liberated. I was certain I was going to be discharged within days, and I wasn't. I wasn't strong enough, and it was then that I fell victim to what I later learned was the Stockdale paradox. James Stockdale was an admiral who was shot down during the Vietnam War and a prisoner of war in Hanoi, and he when he was discharged, when he was finally released, he was interviewed, and one of the interviewers said to him, "How was it that you and your men under your care stayed sane and didn't suffer the emotional trauma that so many other prisoners of war did?" He said, "You cannot lose sight of the fact that someday you will be released. It's important to not lose sight of that."
Mhm.
But the POWs who thought they were going to be home for Christmas or Easter or the 4th of July would come and go. They would lose hope and they would die. And in reading other books, Viktor Frankl said the same thing in his story, Man's Search for Meaning, when he talked about his time at Auschwitz. He said, the prisoners who could look to the future to find some hope, they're the ones that made it. The prisoners who were mourning the past, which cannot be recovered, they withered and died. The prisoners who were so overcome with the horror of their current situation couldn't find the strength to move on. It was only those who really were able to look to the future, to have hope for a better future. Those are the ones that survived. So I had locked in the date that I was going to leave, and that day came and went. And I became very despondent. And I was having a hard time doing my therapy. And one of the physical therapists, she had a passion for ballroom dancing. And so she took my wife and I one evening into the gym, the big gym, this Spalding Hospital, and she turned on like a little boombox with some dance music on it, and said, "Tonight's therapy lesson is you're going to take your wife dancing," which was what? um,
Laughable, yes.
it was like she snowed was serious, and got got up out of the wheelchair, had me take my wife's arm, put my arm around her, and she started talking me through the dance moves, the waltz. And little by little, slowly but surely, I was able to do the waltz with my wife. And it was so uplifting that it really kind of broke that mental block that I had that was keeping me from moving forward. And I still think about that. And because it was her just intuitive understanding of where I was at as a patient and what needed to be done to find a way to motivate me was crucial. My motivation was getting home to my wife and someday getting back to practicing as a physician.
Awesome. Wow. Okay. I know there's more to this story and we need to take a break, but as you've told your story, I think of all the groups now that you belong to because of your experiences. There are only a few people in a group of near-death experiences, people that have seen the light, and you can relate to them. There probably aren't very many doctors who were also critical patients, and you've got that perspective now to add to your toolbox as a doctor. And I mean, there's so much that you've learned from all this that I know it's been a very challenging journey, but also very enriching. And we're going to hear more from you after we take this break. Thank you, Dr. Michael Hession. We'll be right back. Hey there! Isn't my guest amazing? So glad you joined us today. In this world that often feels disconnected, building community and fostering belonging are essential. That's why I created this podcast, to bring inspiring people to you, to encourage you to create that sense of belonging and community, no matter where you are. If you're being blessed by my guest, and we have some more, like, subscribe, and share this podcast. You know who needs to hear this. Stay connected, stay true to yourself, and always remember, you belong. Now, back to our amazing guest. And we are back with our fabulous guest, Dr. Michael J. Hession. Wow, so much involved in that story of his. And I know he hasn't told all the details. You can get his book and read all the special details about it. Also, if you've listened to this podcast, you know I like to ask 3 questions on the second half of our podcast. And the first question is, what do you consider is your greatest accomplishment? Well, there's so much you've accomplished, but what is your greatest accomplishment?
Well, I think it would have to be surviving a near-death experience, then a second near-death experience, rebuilding my life, finding meaning, purpose, and happiness again. It was
that's pretty big accomplishment.
It is, and it took a long time. And I think I talk about that in the book. And
so from when you had from December, was it 18th, 19th?
13th. 13th. 2013.
2013, until you were back into full practice. How long was that?
About a year and a half.
But there's so many roadblocks and discouragements. How did you keep going? And then something else happened.
Yes.
That you had to face.
I had multiple setbacks and hospitalized several times. And then I'd really thought I had made a lot of progress. I started back to work part-time. And my wife and I went to go visit our son, who was getting his master's degree at the Sorbonne in Paris. And we had a fabulous time. He took us all over, gave us a private guided tour of Paris. It was truly breathtaking. And but it took a lot out of me. When I came home, I was exhausted, and I've been struggling with a lot of pain in my hip and my back. I was supposed to have surgery, but it got put off because of what happened previously. And then Mother's Day, I woke with pain in my abdomen, and back to the hospital. And I had acute diverticulitis and an abscess. And that required prolonged IV antibiotics and then surgery to remove the section of my bowel was abscessed and inflamed. And was discharged home. After several days, pain came back. And the anastomosis, the sutures holding the intestines that were stitched back together, started to leak. And it's referred to in medicine as an abdominal catastrophe, where all the contents of your intestines spill into your pelvis. And
That's not fun.
nope,
Not good. Not good.
it's not good at
Catastrophe is
all.
a good word for it.
It was a catastrophe. By the time I arrived at the hospital, I was in shock, and my blood pressure was in the 60s. And they rushed me to CAT scan, saw what had happened, and they made all the arrangements to take me for emergency surgery. And when I woke, I had to have an emergency ileostomy. They had to flush out all the contents of my pelvis and my abdomen, and they couldn't close the wound, so we had to heal by secondary intention. So I was left with a gaping wound. And when I first looked at that, I was in the bed. It was just
You knew too much as a doctor.
I did. That was definitely a big part of the problem. And I just didn't know how I could recover because, I had spent so much time and effort doing the painful physical therapy and gotten through what I thought was the impossible. That again, I was faced with another near-death experience and another prolonged recovery. And honestly, I just didn't know how I could make it forward. And I remembered my father told me, when you find yourself down and you don't know where to go, just get up and move one step at a time. It may take you a while to figure out what direction you're going, but don't quit. Do not ever quit. And so I just channeled that and used the strength of my wife and my family, and I found a way to move forward. And this recovery didn't take quite as long as the first one. And I got back to work after several months. They closed the ileostomy. And after about 2 weeks of healing, they let me go back to work part-time. And I gradually built myself back up and to working full-time. And it was a long and arduous process. And it was slow and tedious and painful. I learned that I couldn't get too far ahead of myself. I just had to focus on the treatment plan as outlined, and then keep myself mentally focused on the present and not look too far or look backwards at what I had lost or what was. And I channeled what I had told my patients. And it's a 3-word acronym that I came up with: acknowledge, adapt, accept, and adapt. You have to acknowledge the situation as it is. If you can't acknowledge it, then you can't move forward. Accept it. Denial or anger doesn't help at all.
Mhm.
And finally, you'll have to learn how you adapt, how to change your life, how to move forward. And getting back to work gave me meaning and purpose. And I found myself wondering if I'd ever find happiness again. And I realized after a lot of reading and introspection that happiness really comes from within, being happy with who you are, who you're with, not looking to the past, not looking to something that may never be, but be grateful every day you're alive for what you have.
Mhm.
And I started keeping a gratitude journal, and that was very helpful. To write down 5 things that I was grateful for and how my life would be changed if I didn't have those. And it was a very powerful, but very simple tool. And I've advised many of my patients when they're recovering from unimaginable illnesses, just focus on 5 things that make you happy. And every day at the end of the day, I would personally thank everybody I worked with. Showing gratitude to other people is a powerful thing too. Acknowledging their hard work made me feel better for doing that.
Mhm.
And I guess it's kind of like altruism. The true gift of altruism comes from the person giving, not receiving.
Yes. Well, and also if you're conscious and looking for things to be grateful for, you're going to find those
Yep.
people and actions that you are thankful for. Don't remember who said it. What a man looks for, a man finds what he looks for. So if you're looking for ways to be grateful, that's what you're going to see.
Yes. It was a very simple but very powerful exercise. And I found what I thought I had lost, happiness. And so it was a long recovery, not a straight line, but I was able to accomplish it. And I found meaning, purpose, and happiness. And I wrote this book. I said at the beginning, I started keeping a journal when I was at Spalding Hospital. And I started writing the book in January of 2020. I hadn't really intended to write a book, but it was when the horror of the COVID-19 pandemic was beginning to hit this country. Our son was a resident in medicine in New York, and he would just say how horrible every day was. People would come in and they'd have to be on life support. Elective surgery was canceled. Every bed was turned into an ICU, and they just had every time walking to work, he'd see refrigerated morgue trucks. Leaving, he'd see a couple more, and it's a very dystopian experience. And a lot of those patients with COVID-19 cytokine storm, essentially that's another way for talking about acute respiratory distress syndrome. So I thought in telling my story, I could help patients and their loved ones share my story and how some of the strategies that I used to overcome what seemed to be an impossible situation to find a way to overcome. And just my memoir with some insights that I gleaned along the way to help other people and their families recover.
Hmm.
And I'm very proud of the book. The feedback I've gotten from people who've written it, the letters I've written, the online reviews on Amazon, they've been very touching. So I think my book succeeded in helping people. Also in
Well,
helping a lot of caregivers too.
it was not written theoretically. I mean, it is from inside you, from what you experienced, and you know, I mean, I'm sure that everything about your experience is coming through on those pages as genuine and authentic, and it's got to, give hope, because you did have dark times. You did have to hear your dad's voice and get up again and keep going. So I can totally see how that would be such a blessing to people. And then with strategies, actual practical, you have to acknowledge where you are and accept it and see how you can adapt. Wonderful. Yes. So your next book is going to be about a gratitude journal.
Yes, I'm working on another book. It's about pain. I experienced a lot of pain uh, during my illness. I was supposed to have had my hip replaced electively in January 14, but this obviously took precedence, and it wasn't for a couple of years until I was able to do that. But it was hard walking, even sleeping. I'd wake up pain when I rolled over. But that was finally accomplished, and pain was relieved. And then the pain from my back started acting up because I was doing more. But I decided not to have surgery. I decided to proceed with aggressive spine physical therapy. That actually worked spectacularly, but again, it was a slow process.
Mhm.
And just strategies of how you deal with chronic pain, how
Mm.
you reprogram your mind. Talk about the concept of neuroplasticity and how anybody can learn new things, whether it's a new language, a new skill. You can learn to train your mind to ignore the pain.
Yes. Wow. There's you've got so much to offer. So as we've talked, you've sort of already answered the other two questions. One of them is what makes you feel like you belong. And in talking about all the support you had with your family, your answer was the love of my family and friends. And yes, they did help you feel like you belong by being there to support you, to encourage you to, you got to get up and dance, do the
Yep.
walk. I belong with my wife. I am going to learn how to do the waltz. I love that story. That's fabulous. You also made reference to what I asked about what is your favorite quote? And do you want me to read the whole paragraph and you can pontificate on it?
Sure.
Okay. Success is not the key to happiness. Ooh, newsflash. Happiness is the key to success. If you love what you're doing, you'll be successful. The purpose of human life is to serve and to show compassion and the will to help others. I don't know what your destiny will be, but one thing I know, the only ones among you who will be really happy are those who have sought and found a way to serve. Quote with that, I did make a few comments in there. Albert Schweitzer. That is powerful. Where so many people are searching for success, but according to this quote, if you search for happiness by helping others, you'll find your success. So, any comments, or how has this helped you, or what do you want to say about your quote?
I think the quote resonates deeply with me. It kind of summarizes who I am as a person and what helped me to be successful and to recover and to rebuild my life. And the love of family, serving others, it gave me happiness. And it wasn't, I realized I wasn't ever going to be happy if I focused on what I had lost. There were a lot of things I couldn't do. I couldn't cover the emergency room or do the hospital work that I used to do. But I let that go. And it was not easy, but it was essential. And that quote really just summarizes and encapsulates what I believe to be true. And I think if people read it thoughtfully and think about it, I think it'll make sense to them. And that, and what I said in my book on my website is acknowledge, accept, and adapt. That's how you survive the unbearable, the unknowable,
Mhm.
find and move forward.
Everyone has some way that they can help other people. There's something everyone can do that will help someone else. There's nobody that doesn't have something to offer. There's a lot of double negatives in there, maybe, but right?
That's absolutely true. I think, you don't have to be a physician or a nurse. There's many ways you can help. Volunteering. There are a lot of things you can do, and they're useful and will bring you joy and happiness and make the world a better place.
One of the things you already mentioned was gratitude. And if all that you can offer is gratefulness to people for what they're being or doing, that in itself is a gift.
It
And
is. And I think too often people try to define happiness as success. It really is the reverse. If you're happy, you'll be successful at whatever you do. It's like when you're around unhappy people or miserable people or chronically complaining people, they constantly bring the mood down and prevent forward progress. And happy people are easy to get along with, and they help to move whatever needs to moving forward to successfully move forward. It's just a simple attitude adjustment, but it's crucial to happiness, finding the good in life.
Absolutely. And if you're looking for it, you'll find it.
Yes, you will.
This has been so enlightening, encouraging, inspiring, and all the things that I can say and be so grateful, speaking of gratitude, that you joined us today and shared your story. Before we close, which we need to close in a few seconds or minutes, do you have any final words or a final message that you would like to leave with our belongers, our listeners?
I think if you liked what you heard, I think you will like the book even more. I would encourage you to buy my book, Physician Heal Thyself, Nearly Dead on the Journey Back to Health. It's on Amazon and a number of bookstores. I didn't make it overly long. There are lots of references if you want to dig deeper into certain topics. But it helps normalize what for many people is overwhelming with an acute critical medical illness. And when you realize that this is something that other people have gone through, and I try to outline strategies that worked for me, and I think are pretty straightforward, not necessarily intuitive, particularly when you're in pain, but strategies to help you recover and help your loved ones who were suffering the trauma too. And to realize that, post-traumatic stress disorder from critical medical illness is common, and you have to be able to admit it and get the help you need and talk through it. It's definitely something that can be overcome. It doesn't need medication. It just really needs talking through the problem. And writing my book, in many ways, is a very therapeutic exercise for me.
Yeah, I was just thinking, it's not medication, it's mentalcation.
True. That's very well said.
I'm going to coin that phrase, mentalcation, not medication. Okay. Thank you again. This has been fabulous. To our amazing guest, Dr. Michael J. Hession, thank you. And to our listeners, belongers, stay connected, stay true to yourself, and always remember, you belong. This is Dea Irby with Here Where You Belong podcast, signing off. Bye.
Bye-bye, Dea.
Thanks for tuning in to Here Where You Belong. We hope today's episode has inspired you to embrace the beauty of belonging in your own life. Remember, no matter where you are or where you're headed, you have a place where you truly belong. Join us again next time for more insightful conversations and heartwarming stories. Until then, stay connected, stay true to yourself, and always remember that you belong.